he left me in the room alone. I had to use the bathroom, so I got up and went. When I looked in the mirror, I could see bone, blood. I was just like, oh my God.
When I was going to clubs all the time, I met other girls like myself, and they were all into plastic surgery. So I got into it too. I had my first facelift at 29 years old, and that was crazy. I've had my brows lifted, my cheeks augmented. I've had nose jobs, don't know how many. I like how I look. My motto is go big or go home. I have had over a gallon of liquid silicone in my body. I wish I had never done the liquid silicone. I've had it shot into my hips, in my rear, in my breasts. I didn't have any problems for a good 10 years. And then it started migrating. Skin started getting a different texture and things started to change. That's when I started my quest of reconstruction surgery. I have pixie ears. Apparently, the pixie ears came because of the previous facelift. They put so much tension, it pulled the ears down. Summer's coming, my video's coming, bikini weather's coming, and it's time to, you know, regain my youth.
So tell us a little bit about your journey with plastic surgery
Okay.
and where you've come from to this point.
When I was 14 years old, I started a black market hormone therapy.
At age 14?
Yeah, at 14. Anyways, in the black urban community, the transgenders get silicone pumped in their cheeks, in their breasts, in their
Injecting anything permanent into any part of your body is a bad thing. Injecting silicone destroys the underlying tissue by causing a severe inflammatory response and becomes a chronic problem.
So then I learned about facial feminization. I wanted to do it here in America. And when I told the doctors I had silicone in my face, he was like, no. That's when I went to Thailand. And the doctor said, I will saw your cheekbones.
Wait, whoa.
But that's another dangerous procedure.
That's dangerous?
Yeah. There are so many good plastic surgeons in this country, and medicine generally is the safest that it can be anywhere in the world. So you should never go outside of the United States for any surgical procedure.
As the year went on, this right cheek just would not stop.
So is it just the right cheek that's bothering you?
Just the right.
You think it's a little bit too big?
I think it's too big. When I smile, I think it's just too big.
Okay, we see that.
You see?
But I told her, what if you do surgery with the cheeks and you make an even more big problem? You know?
That's always the consideration we have.
Constant injection and modification of her cheeks with silicone. It's dangerous.
We always wonder at what cost if we go in there. There's a hole here right through the bone of the skull where an important sensory nerve comes out. If you bugger up that nerve, you can't move, and you're like,
The nerves are
This
dead.
is just down.
dead, and there's no going back.
And you're not afraid to have your cheek operated on you?
No, absolutely not.
This is something a little bit different. Do you know who Janice Dickinson is?
Of course.
First supermodel?
Yeah, and she's already actually had a good amount of work done. Well,
Hi, I'm
hello.
Janice.
Wow.
Janice, Stephen, which is which?
I don't know. It's a good question.
Janice. Hi. How are you?
Dr. Nassif.
Nice to meet you.
Pleasure.
Dr. Nassif.
Heard so many great things about you guys.
Really? We'd like to hear
Yes.
that. Please have a seat.
Yay. Hopefully, you can help me with my breast.
What bothers you most about your breasts?
My silicone breasts have been in there for about 30 years. Yes.
When you get your breasts done, you're really supposed to have them replaced every sort of 10 to 15 years. Implants that are more than 13 years old have an 83% chance of being ruptured. These implants being from the 70s, who knows? We may take them out, put them on there, there might be streaks of cocaine still left on them.
I feel like that there are particles that are rolling around that, like the size of edamame.
The good news is you were done the old-fashioned way, which is to put those old...
Stop saying old.
Those...
Antiquated or anything.
Antiquated, you had the other silicone implants put in on top of the muscle. That was the that was the other way that was done previously. Theoretically, we would take those implants out and then lift up your pectoralis major muscle, peeling it off the ribs. And then lining the inside of the breast pocket with them so that the new implants go under the muscle.
Well, I'll be under anesthesia, right?
Yeah.
I don't take narcotics, but
You don't take any narcotics?
Well, I'm gonna have to take narcotics for this, but you know, I'm sober. I have had drug and alcohol issues in the past. I'm nervous about doing this operation sober without taking pills to calm my nerves and my anxiety. Yeah. So there's like, you know, I'll go to a recovery center and that'll be good.
It'll be good.
We'll just work within my program of finding the easiest, softest way we can go through this operation.
I started modeling when I was 10 years old. My mom thought I'd be really great at it because I was such a spunky girl. But when I was 16, I got advice from a photographer who told me that if you want to make it in this business, you're gonna have to get a nose job. I didn't think I needed a nose job, and I was actually kind of insulted. After I moved to New York to pursue modeling, I just kept getting the same feedback. And I noticed that the girls who got the jobs had thin noses. So I faced the fact that I do need to get a nose job if I want to book more jobs. I felt like if I don't do it now, my career may never take off in modeling. Immediately after the surgery, I knew something was wrong. First of all, there was a piece of cartilage sticking out. He kept telling me, oh, it's just swelling, don't worry. But I knew something was wrong because my nostrils were different sizes and shapes. I was mortified. A year later, I decided I'm not gonna live with this nose anymore. I called the same doctor and he said, come on back and I'll do it for free. He numbed me and covered my eyes, so I was gonna be awake. It was about 2 hours into the surgery, he got a call or a page that he had to see another patient, and he left me in the room alone. I had to use the bathroom, so I got up and went. When I looked in the mirror, I could see bone, blood. I was just like, oh my God, what am I doing? But I had to go back in and let him finish. Afterwards, it looked straight, but a week or two later, it started leaning to the left and to the left, and I just said, forget it. I gave up my modeling dreams.
You were like the sexiest hood ornament of the 80s, basically.
Thank you.
I did
Back
notice
then,
that.
no breasts.
No breasts.
So what made you want to get breasts when you were doing so well?
It must have been something inside of myself where I wasn't feeling secure enough about myself and thought, oh, well, this will take care of the problem.
Okay.
I can't imagine the pressures that Tony must have been feeling at the height of her career. And maybe getting a little enhancement can keep her at that top a little longer. But, you know, I gotta tell you, it's a scalpel. It's not a magic wand.
The 5th and 6th is really where it all started going wrong.
Okay.
So when I was under, the doctors took the liberty of putting in the size that they felt was going to suit me. And then it gets worse. So I go back to the doctors and I say, look, they're too big. Great, we'll take them out and we'll make your implants smaller. Within 6 months, the implants started slipping through the mesh.
They bottomed out.
And now the implants are like down to the bottom of my rib cage.
On that last revision with the mesh, did they downsize them too?
They did downsize
Are
them.
you happy with the size?
No, I'm not.
It's still too big.
They're still way too big. I don't want the implants at all.
Oh, you want to do without implants entirely?
Right.
It's unusual for an actress, entertainment type person to want to not to have implants anymore, but after a certain period of time, you're fed up with implants and complications associated with them. So I applaud Tawny for wanting to get rid of them.
What you do is you grab hands with the kids, and then you go in a circle, and then, you know, we were going too fast, and I was going like this. I ran into the wall.
Oh. So you hit the wall with your chin?
With my chin first, yes. And then after that, as time went by, it was just deforming.
So we call the deformity peau d'orange, which is an orange peel in French. If you look at the orange, there's like these little bumps and little indentations in it. So with Yasmin chin, that's what it looks like, and that's because of trauma to the mentalis muscle. That's what causes the irregularities of her chin.
When I was about 14 years old, we found a plastic surgeon. They took out fat from my tummy and reconstructed my chin.
Did it work at all?
I did see a slight difference. It was just a little bit fuller. After the time went by, it just went away.
Yeah, the fat went away.
Yeah.
Especially in an area where there's a lot of movement, and that muscle underneath the chin here, well, it's constantly moving as you speak. Did you have any other procedures?
I did. I had one when I was 25, another fat transfer. And then until again, time passed by and it just went away again.
So nothing else after that?
No, I have not.
Is it worse now than it was before you had anything done, or is it better now?
I would say it's worse.
Yeah. Yasmin had fat transfer to try to smooth the contour regularities of her chin. The problem with fat transfer is some of the fat will take, some will absorb, and that really predisposes you to more lumps and bumps and more irregularities. They really should have focused on a procedure to try to smooth the skin and the overall contour.
What drives you crazy about your chin?
The indentation, so maybe if I could just even it out.
It's not an easy fix. Obviously, as you know, you've had 2 surgeries, and there's a lot of muscles that pull the lip down. I really feel bad for Yasmin, and I want to do everything I can to help her. But here is the risk with trying to fix the chin in this area. 1, you can make the dimpling worse. You can actually knock out the sensation to the chin. You can actually injure the motor nerve, which controls the movement of the lower lip. Or you can make the scar tissue more deformed. All these things could happen with surgery.